Welcome to the Introduction to Care Navigation. From ADAI, the Addiction, Drug, and Alcohol Institute, CEDAR, the Center for Community Engaged Drug Addiction Epidemiology and Research, with the University of Washington. First and foremost, I would like to welcome you to Care Navigation. I have made a list of commonly used terms and acronyms that is available to print. I would suggest to use it as a reference point in case you don't know a certain term or acronym. It can be helpful for not only this video, but in the other videos as well. A little bit about me. My name is LeiLani. I am a certified peer counselor and a medical assistant phlebotomist. I've been working as a care navigator for Multi-Care Deaconess here in Spokane since 2021, and I've been working for ADAI as a care navigator trainer since February of 2023. I am a person with lived experience from polysubstance abuse and being unhoused. I have been in recovery since 2018. I grew up in Idaho, but moved to California, where I lived for a brief period of time before moving up here to Washington in 2018. I love my job as a care navigator. The work is challenging, but the rewards are amazing. I love helping people and supporting them through one of the hardest times of their life. There's nothing quite like watching somebody go into the transition into recovery. Watching the light and the life come back into their eyes is the biggest reward possible. A little bit of the job description as a care navigator. Care navigator is usually a person's first contact besides reception, and a lot of places don't have a reception. The role of a care navigator is to find the patient's needs through a trauma-informed approach and to use shared decision-making to find the best possible place to refer them. We will go over how to make a referral list in your area in another video. A care navigator can help connect people with the best MOUD program that works for them. They can refer for mental health services, treatment programs, both in and outpatient, and also withdrawal management. Working with a patient. How do you connect and earn trust? I like to say a peace offering. If your site offers clothes, drinks, or snacks, this can be a good way to break the ice, and it shows some compassion. That little gesture can really mean a lot to somebody, and it can open them up, and you can start gaining their trust. By gaining their trust, you discover what their needs are, whether that be treatment, MOUD medications, clothing, food, housing, anything. There are more details on finding the right resources in an upcoming video, how to find the best MOUD provider. As a care navigator, we want to grow. I suggest to attend as many in-person, virtual, and recorded trainings as possible. Some good examples are ADAI and California Bridge. They offer great virtual trainings and have a lot of recorded trainings as well. Google sites that may offer helpful videos for information. Some suggestions: motivational interviewing, trauma-informed care. That way we can best learn how to help the people that we are working with. How to build a resource list is an upcoming video in this series. You want to stay up to date with local resources and programs in order to refer the people that you are working with. It is important to know where you're referring. Now we'll go over what a navigator does and doesn't do. A navigator does not discuss medication doses. That is not in our scope. Don't talk about what dose we may think someone should be on, or offer any advice on dosing recommendations. That is the job of an RN or a provider. We always talk about Narcan and safe use. We want the people that we are working with to stay safe. We don't override their choices with our personal opinions. We are there to support them and their opinions and choices. We do support the patient and what they want, regardless of what we think is best for them. We do find the best possible way to help them achieve success in their choices and help them overcome the barriers that they may face. Again, welcome to Care Navigation, and please feel free to reach out to me if you have any questions or would like any additional training or advice. I have put my email in there and I am very responsive. Thank you.